This is Nyalenda, Kisumu County, where we meet Carolina Otieno doing house chores as her youngest assists playfully. In an area where pools of water form due to a poor drainage system, this mother of four knows all too well the nightmare of malaria. Launched in 2019 in Homa Bay as the first part of a phased pilot program, the Ministry of Health was targeting to inoculate 120,000 children annually in 8 counties in the Lake region that bore the highest malaria burden in the country. At 2 years of age, Angel, unlike her older siblings, has not yet felt the wrath of the mosquito-borne disease.
Huyu mdogo naona ako sawa, au wengine sana mwenye amefuata alikuwa ananisumbua na kwenda kila mara na admitiwa malaria. Na huyu vile nilikuwa nampeleka hizo chanjo, sijaiona nikisumbuliwa na malaria.
Administered in 4 tranches, the first 3 doses of the RTS S malaria vaccine are administered between 6 and 9 months, with the final dose coming in at 24 months of age. According to data from the Division of National Malaria Programs in Kenya, the country had fully vaccinated 45,000 children against malaria by April 2022, with another 275,000 having received at least one of the 4 scheduled malaria vaccine doses. In Kisumu, about 25,000 children have been fully vaccinated, with 9,000 more having received part of the RTS S dose. In 2001, Kenya spent a total of 1.2 billion shillings in the procurement of malaria diagnostics and treatment commodities that aided in the treatment of 5 million malaria incidences in the past year. The country also invested in treated net distribution programs, the issuance of sulfur tablets to pregnant women, alongside the routine insecticide spraying as preventive measures against malaria. Despite the high uptake of the vaccine, instances of vaccine apathy have been recorded at 5%, with the government attributing the shortfall to a near mismatch of integration into the childhood immunization calendar.
The other child immunizations are within a period of 0 to 14 weeks, and you see after that then there is no any other vaccine except going for weighing and weight measurements and other assessment. So we have malaria vaccine now being introduced at 6 months.
Though there is no explicit law that makes it mandatory for parents to ensure that their children follow the country's immunization schedule, Kenya, according to the United Nations Children's Fund, has increased its immunization coverage from 82% in 2000 to 92% in 2019. Molly Awor, a mother of 7, did not take her son for the final dose of the vaccine, saying she saw no urgent need.
Sasa sikuenda usi. Ana malaria. Hata kikiwa na joto nikimpeleka usi ukipima malaria wanapata kama ana malaria.
According to the World Health Organization, under 5 children are most vulnerable to the malaria disease, with this age group accounting for 67% of malaria deaths globally. The Kenya National Technical Advisory Group has given the country a green light to rope in more counties in the Lake region to vaccinate children beginning June 20th.
The ministry has received a positive advisory from the Kenya National Immunization Technical Advisory Group to expand the use of malaria vaccine within the Lake endemic region. This means that more sub-counties within the Lake endemic region will now be able to vaccinate children with the vaccine starting June this year.
Serikali tusaidie kwa nets na hiyo vaccines kwa watoto ya malaria, doses ziko sawa. So nilikuwa naomba tu watusaidie wa maintain hizo drugs, wa maintain doses, at least watoto wenye wanaenda kizazi ijayo wakuwe sawa, wakuwe protected.
And the scientists burn the midnight oil to develop antidotes to some of the world's deadliest diseases. The RTS S malaria vaccine is a colorful feather on the heart of this initiative, casting a ray of hope in the field of medicine, showing that Africa is well on course in the fight against the flying phantom and ultimately eradicating the endemic malaria scourge.